What is a migraine? A migraine is a name of one type of headache condition. Because there are many different types of headaches, healthcare professionals use an international classification system to help us work out a child or a young person's headache diagnosis. Migraines and headache in young people are a very common problem. When surveyed, almost 3/4 of young people in the UK experience headache in the last 1 year. Is a migraine the same thing as a headache? A migraine has a head pain as a symptom, but it also has additional, more specific symptoms. This can include warning signs, often called as aura, a throbbing quality to the head pain, nausea, and dizziness. After a child or a young person has a migraine attack, they can feel tired and lethargic, and it may take them some time to recover. Headache, on the other hand, refers to any head pain. You may find that the terms headache and migraine are used interchangeably, which can cause confusion. What are the different types of migraine? Migraines, like all types of headache, can show themselves in many different ways for each person. For children and young people that are struggling with head pains, it's important that they listen to their body to understand the feelings and signs that are associated with their head pain. Although I understand that this can be really hard when experiencing pain or other signs, being able to describe this to a healthcare professional helps with the diagnosis. There are two main types of migraine. One is migraine without aura, which is sometimes called a common migraine, as it is the most common type. This type of migraine is a recurring headache, which is moderate to severely painful. The pain feels like it pulses, and people can feel nauseous. It can make people throw up. These symptoms are often intensified with light, sound, and physical activity. Other symptoms can include dizziness, yawning, and lack of energy. Mood change and needing to pee more often can also be part of those symptoms. The other type of migraine is migraine with aura. Aura affects about 3 in 10 people who have migraine. The word aura means that there are changes that the person experiences before or sometimes during a migraine attack or a headache episode. An aura usually comes at the beginning of a headache attack, before any of the other symptoms, including pain, begin. It may be something that you see, such as a bright light or shapes or lines. They may experience a distinctive taste or smell, or feel objects are sometimes different distance away than they are in reality. Aura can be confusing and can make people feel really anxious. The feelings do go away, and it's important to stay calm and tell somebody how you feel. In children and young people, the length of the migraine attack can vary from a few minutes to a few days. To be given a diagnosis of migraine, a person has to experience them repeatedly. What are the other different types of headaches? There are various types of headache conditions as well as migraine. Some of the most common types are tension type headache, medication overuse headache, new daily persistent headache, and cluster headache. I'm going to tell you a bit more about each one of them. Tension type headache feels like an ache on both sides of the head and across the forehead. Sometimes you get sore eyes and have a sore neck muscle. They're not usually severe enough to stop you from doing something, and usually over-the-counter pain relief can be helpful. New daily persistent headache happens suddenly without warning. The symptoms are continuous from the onset for days and then months and sometimes even longer. Usually, older children and young adults can give an accurate date of when the headache began. The headache feeling is often described as a pressure-like or a tightening sensation across the forehead or the head. Cluster headache is when pain is over one eye and fixed to one side of the head. The pain can reach a highest intensity within about 5 to 10 minutes, and can last several hours. People may experience this as a cluster, which is a repetitive, severe head pain over a few minutes or hours on a recurrent basis. This may come several times a day with a bad attack. Additional symptoms on the same side of the pain can be a runny nose, sweating on side of the face, and changes to the eyes and a red face on the same side of the pain. Medication overuse headache happens when you take pain medications to treat the headache condition too often. This includes medicine that you can buy over the counter in a pharmacy, such as paracetamol or ibuprofen, or prescribed medications such as a triptan. People can find themselves in a distressing cycle where using over-the-counter pain relief daily creates more headache than they would naturally be having. That's why healthcare professionals advise the 2-day rule. This is when no symptom medication is taken for more than 2 days in a week. How can migraines affect life for a child or young person? We know that for young people with severe headache, including migraine, they can feel really unwell at times. Life will be more challenging when symptoms are at their worst. It may be difficult to attend school or your usual clubs due to difficulties with focusing or doing physical activity. This can make them feel as if they are missing out on important aspects of life, which can cause frustration and anxiety. It can be hard for children and young people to talk about how they are feeling, and they might feel very alone, as though nobody understands how seriously the symptoms are impacting them. There are also often misconceptions about headache conditions, that a young person can take over-the-counter pain relief and get on with it, or that they are exaggerating the symptoms, even using them as an excuse to get out of things they don't want to do. It's important to seek medical advice for headache symptoms. Headaches could also be a sign that something else is wrong. Headache specialists are experienced at caring for people with mild, moderate, and severe symptoms and will acknowledge that these symptoms are real and can be debilitating. They are able to explain, help, and manage the physical, emotional, and lifestyle causes and impacts of the headaches.